Hello, and welcome. Today, we're diving deep into Sjögren syndrome, a systemic autoimmune disease that often targets moisture-producing glands, but can also affect the nervous system. While it's known for causing dry eyes and dry mouth, the impact can extend far beyond these common symptoms. The precise cause of Sjögren syndrome remains a complex puzzle. It's considered an autoimmune disorder, meaning the body's immune system mistakenly attacks its own healthy tissues. Genetic predisposition plays a significant role, meaning some individuals are more likely to develop the condition due to their inherited genes. Environmental triggers, such as viral or bacterial infections, are also suspected to play a role in initiating the autoimmune response in genetically susceptible individuals. The interaction between these genetic and environmental factors is what likely contributes to the development of Sjögren's. Let's break down what happens inside the body. In Sjögren's, immune cells, specifically lymphocytes, infiltrate and damage the exocrine glands, primarily the salivary and lacrimal glands responsible for producing saliva and tears. This infiltration disrupts their normal function, leading to decreased production of these fluids. But the immune system doesn't always stop there. The inflammation can extend beyond these glands, affecting other organs, including the nervous system. This occurs as immune cells may attack the nerves directly or indirectly by causing inflammation of the blood vessels supplying the nerve's vasculatus, or the protective covering of the nerve's myelin sheath. This damage to the nervous system is responsible for many of the neurological complications associated with Sjögren's. Sjögren syndrome is estimated to affect between 0.5 and 1% of the adult population. It's significantly more common in women than men, with a female-to-male ratio of approximately 9:1. While it can occur at any age, the average age of onset is typically between 40 and 60 years old. It can affect people of all races and ethnicities. While the numbers reflect a significant amount of the population, this still does not account for undiagnosed or misdiagnosed cases. The classic hallmark symptoms of Sjögren's are, of course, dry eyes and dry mouth. Dry eyes can manifest as a gritty burning sensation, blurred vision, and increased sensitivity to light. Dry mouth can cause difficulty swallowing, speaking, and tasting, as well as an increased risk of dental cavities and oral infections, but the systemic involvement can lead to a wide array of other symptoms. Joint pain and fatigue are very common. When the nervous system is affected, the symptoms can be diverse and may include peripheral neuropathy causing numbness, tingling, or pain in the hands and feet. Other neurological manifestations can include cognitive dysfunction, migraines, seizures, even in rare cases, even multiple sclerosis-like symptoms. Diagnosing Sjögren's can be challenging as symptoms can overlap with other conditions. The process typically involves a combination of assessments. This includes a thorough medical history and physical examination, blood tests to check for specific autoantibodies like anti-ROS-SA and anti-LAS-SB, which are frequently found in individuals with Sjögren's. Eye tests such as the Schirmer's test measure tear production. Salivary gland function can be assessed through salivary flow rate measurements or a salivary gland biopsy. Neurological evaluations, including nerve conduction studies and MRI scans, may be conducted if nervous system involvement is suspected. The American-European Consensus Group criteria are often used to help standardize the diagnosis. While there aren't distinct subtypes of Sjögren's like there are for some other autoimmune diseases, it is often classified based on the extent of the disease. Primary Sjögren's occurs when the condition develops on its own, without being associated with another autoimmune disorder. Secondary Sjögren's, on the other hand, occurs in conjunction with another autoimmune disease, such as rheumatoid arthritis, lupus, or scleroderma. The distinction is important because it can impact the treatment approach and overall prognosis. Currently, there's no cure for Sjögren's syndrome, so treatment focuses on managing symptoms and preventing complications. For dry eyes, artificial tears, lubricating eye ointments, and prescription medications that stimulate tear production are often prescribed. For dry mouth, artificial saliva, frequent sips of water, and medications to stimulate saliva production can provide relief. Systemic treatments, such as immunosuppressants and biologics, may be used to manage more severe symptoms and prevent organ damage. For neurological manifestations, treatment focuses on addressing the specific symptoms. Pain medications, physical therapy, and medications to treat neuropathic pain may be recommended. If vasculitis is present, immunosuppressants may be necessary. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, is also important for overall well-being. Unfortunately, there's no known way to prevent Sjögren's syndrome, given that it's an autoimmune disorder with a genetic predisposition. However, certain lifestyle choices can help to manage the symptoms and reduce the risk of complications. This includes avoiding smoking, maintaining good oral hygiene, and protecting the eyes from excessive dryness and sun exposure. Staying hydrated and managing stress can also be beneficial. The prognosis for individuals with Sjögren syndrome varies widely depending on the severity of the disease and the extent of organ involvement. Many individuals can lead relatively normal lives with proper management of their symptoms. However, some individuals may experience more severe complications, such as lymphoma, lung disease, or kidney problems. The presence of neurological involvement can also impact the prognosis. Recent research is focused on identifying biomarkers that can help predict disease progression and treatment response. There's also ongoing research into novel therapies that target specific immune pathways involved in the pathogenesis of Sjögren's. The goal is to develop more effective and targeted treatments that can improve the long-term outcomes for individuals with this complex and challenging condition. Thank you for watching.